We're Project Real empowerment on all levels. We're here to tell you about the healthcare needs of the lesbian, gay, bisexual, transgender, queer, and/or questioning community. LGBTQ for short.
So sexual orientation is our romantic, emotional, or sexual attraction to others. The most common sexual orientations are gay and lesbian or homosexuals who are attracted to the same sex, straight or heterosexuals who are attracted to the opposite sex, or bisexuals who are attracted to the same as well as an additional sex. However, for some, their sexuality does not exist in these categories, but instead on a spectrum. It's important for our community that you understand that sexuality does not exist in black and white, but instead a rainbow.
According to the CDC, 1 in 2 African American gay and bisexual men, 1 in 4 Latino gay and bisexual men, and 1 in 11 white gay and bisexual men will become HIV positive. 40% of transgender adults have attempted suicide.
While biological sex refers to your anatomy, your hormones, or the chromosomes that you were born with, gender refers to the attitudes and behaviors a given culture associates with a specific sex. Gender identity is how a person identifies on the gender spectrum, be it male, female, both, or neither. People that identify with multiple genders are considered genderqueer or gender fluid. Those who identify with no particular gender at all are considered agender. The way a person expresses themselves via their hair, makeup, clothing, mannerisms, and the like, that is their gender expression. Every person's gender expression is unique to them, all across the gender spectrum.
LGBTQ people are 2.5 times more likely to experience mental illness than their straight counterparts. 40% of homeless youth are LGBTQ.
Coming out is disclosing one's sexual orientation or gender identity to others. For some, this may be an empowering experience, but for others, it may be traumatic, resulting in a loss of family, friends, or even their home. It's important for us to disclose our sexual orientation or gender identity to our healthcare providers so you know who you're treating. And it's also important that our providers provide a safe, stigma-free environment where we feel comfortable coming out.
89% of trans people fear healthcare providers are not adequately trained to treat them. More than half of all LGBTQ people have experienced discrimination in healthcare settings.
Acceptance can make or break a person. Having a loved one in your life who accepts you for who you are is an indescribable feeling. For some, it might take time, help, and support to get to the point of acceptance. However, having a healthcare provider who accepts you for who you are can break down many barriers.
Many of us do not have a supportive or accepting biological family. Chosen family have become our support system. It is important for healthcare providers to understand who we consider family.
Stigma are assumptions that we make about others that can often be hurtful and many times are incorrect. When we act upon these assumptions, we belittle and ignore the identities of the people that we're dealing with. To stigmatize somebody is the same as essentially putting a giant red bullseye on their back. When our clients come to us and they feel stigmatized, they feel unsafe. When they feel unsafe, they cannot disclose comfortably accurate information. If we as providers can't give accurate information, we cannot provide adequate care for our clients. The best way to defeat stigma is to educate yourself. Ask the questions. Ask your client about their gender identity. Ask their preferred pronouns and the name that they prefer to be called. Ask them about their sexual orientation. Ask the questions. Together with your clients, we can end stigma.
1 in 5 LGBTQ people reported withholding sexual health info in healthcare settings.
There are many different health concerns prevalent within each community. Our community is no different. Substance use, domestic abuse, smoking, mental health, and higher STI rates are just some of these challenges. Healthcare providers and clients need to be aware of this and overcome these challenges together.
Many LGBTQ elders delay medical care out of fear of discrimination. Suicide rates are 4 times greater in LGBTQ youth than their straight counterparts.
Anyone can be an advocate or ally. If you do not identify as LGBTQ, but have taken something away from our video here today, you've already taken your first step to being an ally. These important members of our community are there with acceptance, advocacy, and support, regardless of their sexuality. If you'd like to learn about how you can be a better ally, find a local LGBT organization and see how you can help.